Very good afternoon to all of you. Myself, Abhay, I lead the business for Nura. And thanks Nandan and Nida for the insightful. Of course, I'm not going to share these many data points because I try to solve one of the problem in the whole system. So I'm not from HR, but I deal with HR on the day-to-day basis and try to solve one of their problems, that how we can address that. So, as you can see, I'm going to talk about the AI way of health screening. So, it's very imperative for us that we go through all the cycles, we maintain healthy lifestyle, we take care of ourselves mentally and all those things. But periodically we need to know that how healthy we are. Is our body, is the way we are looking at it. That's how we have done that. When we look at this image, we all inspire to go for surfing. When you look at this image, we all want that our employee, our teammates, our colleagues are there in this state. They are enjoying their time, they are fit, they are in the peak of their health to maintain and enjoy their surfing like this. So that's what we say that, I'm sorry.
The medicine did not work?
All this problem is going to happen for our session.
Because we have presentation. Nobody had a presentation.
It's working now?
No, I don't know.
Yes,
Correct.
yes. Yes, yes, yes.
Heart surgery had to be
So, yeah, thank you.
Heart surgery gone.
Yes. What we say, that health screening lets you keep doing what you love to do that. Today the business environment is changing quite rapidly, and having diversity and inclusion in our workforce is imperative. Today's strategy, HR function is just not a functional. It is becoming more and more strategic for individual to increase the productivity of the employer. So it is imperative for organization that how well and how they initiate all the well-being initiative in the organization and how meticulously they implement that. Sorry, this is something. So we are talking about employee well-being. So just our services completely fit into this two bucket of employee well-being and the engagement. How we can bring the well-being quotient among the employees and how we can take care of their engagement. So considering that, so we have started. We introduced AI in our health screening, where when we talk about AI, since morning we are talking about AI. AI's role is to make these things more robust, accurate and precise so people can depend on that. It's not like that AI will do everything for us. So we are using AI as a tool for precise and accurate outcome for whomever we try to screen about that. We are also taking care of their safety, because we started using new technology. We have started using CT, we have started using 3D digital mammography, we started using DEXA scan. These equipments and the instruments are important, and internationally these equipments are used. But the problem with this, it has safety issue. So what we have done, we started using ultra low dose of radiation, which is equal to just one X-ray, so that we take care of the safety of the employee. We have also not running behind or chasing behind the number of tests that, okay, we have taken this service, how many tests we are going to do? 20, 50, 100, 200. We are not looking at that. We have adopted an approach where we are looking at the individual's organ. So we have adopted an approach where we are screening about 18 critical organs of the human body by which we can say that he or she is healthy. This also helps employee to be more confident because when he or she comes in, when they go out from our center, they feel more confident of themselves. And when we think about health checkup, we feel really stressed. Oh, my whole day will go. I have to go in the morning, I have to come in the evening. So looking at that, what we have done, we have tried to remove all the pain point in that whole journey and make it in such a way that you come at my center and everything taken care in one go. So how for employee it is engaging. First thing that we made it in just 2 hours, 120 minutes or 2 hours. You come to my place, get yourself thoroughly checked from head to toe and go out in 120 minutes, which includes your reports, your health record, and the doctor consultation put together in one go. This everything happened under one roof. It's not like that you need to go different center because we are doing it right from the head to toe, so you have to visit different places. So we try to make it simple for employees so that they are happy. Unlike hospital where when you visit or lab when you visit, you see a lot of unhealthy people, some healthy people. So those who are healthy, they feel very anxious about that. They will contract some kind of infections or disease. So in order to address that, we have created such a serene environment where you will not feel intimidated. We only take 32 people in a day for screening. All are healthy. We do not take any patient in our system where we need to evaluate their health because he knows that he has certain problem. He need to go to the doctor. He need not to come to my place. That's how we have created. We generate the reports in the real time. Person need not to visit as I have mentioned earlier. And we have also changed the reporting system into a ABC category where they feel more engaged. They can understand the report in the form of ABC. Everyone likes A. In school days, we like to get as many as A. So similarly, we have graded our reports in category where we talk about A, B, C, D. So everyone understands A means good health, D means they need to take care of that. So I'm just talking about that. So I will just emphasize what screening exactly means. What happened in routine case? When we get unwell, we have some kind of stress, we go to the doctor. Doctor listens us, asks for the symptoms. Based on the symptoms, he prescribes certain tests, writes certain medicine, and then he follows the treatment procedure. Unlike that, this is a proactive approach when it comes to screening. Where any individual can come where they feel they are healthy, they say that, okay, I don't have any problem. It is targeted toward that. Because today we are stressed. We are stressed in our personal life, we are stressed in our office, we have very long hours, we do not have correct meal time, anything. So we are messing up with our health all the time. So it is important for us to come and get it done. So when you see that when healthy people comes, we look for the preventive orientation towards that. We do not want to say that if you are unwell, then only you come. When you are healthy, when you feel that you do not have any problem, please come to us. That's the whole idea when I say screening. So what does NURA is? NURA stands for New Era. It started by global giant Fujifilm, who is there into the business for more than 9 decades. And they are world's largest medical equipment manufacturer. They manufacture right from the X-ray machine to MRI, CT scan, you name it, they make it. So they thought that it is very important that they go near to the consumer and they enhance the quality of the screening. Because today what we are talking about, we are all serious. Nandan was talking about Zero, the founders. he got stroke due to the stress. So it is important for that they undergo this. In Japan, where physician belongs, 89% of working population periodically get screened every year. Unlike our country where not even 20% of people are working population, I'm not talking about mass. Only just 20% of people undergo health screening. Though many organizations have a policy that they have health screening available for everyone. But very few people come forward to take. So as a HR, I'll request you, please persuade people to take regular screening. They need not to come to my place, they can go anywhere, but they should be well informed about what in their health is going on. Recently I have come across this article where, say early detection of lung cancer can save life. Why this is happening? Because in India we lack the systematic prevention program. We do not have any systematic preventive program where we go through it. As and when we feel good, or someone at home is stressed by the parents or spouse, or you have not done your health checkup, then only we go. Otherwise we avoid because we feel it is not needed for me. And there is a lot of inertia which is there because we have to go in fasting, we have to go early in the morning, I will take whole day. So there's many inertia which you have to break. So that's how that we have created a system where this can be taken care of that way. We are using AI, so I wanted to emphasize on this one that how we are taking advantages of AI in our screen. It is not that we wanted to tell you that we'll predict your future, that you will not get anything in your life for the next 5 years or 6 years. The day I start doing it, let's say some healthy person, I say that you will not get any problem. The moment I say step out, start smoking, start drinking without any control, and the problem and situation will go out of his hand. So we do not predict anything, we just tell you the status of your health, whether you are in good health or whether you are in a bad health. So we are using a dual AI. So if you look at here, so the first AI where we are looking at the picture, because we are using ultra low dose radiation, the image is very hazy and noisy. What first layer of AI will do that it create high definition image. And so compared to the regular CT scan, when you see that it enhances the quality of the image. And second layer of AI also will do the interpretation to find out if there is any kind of abnormality in the organ. Similarly, when I talk about ultra low dose of radiation, that means generally any health screening involves X-ray, just X-ray. So we are using 0.2 milligram of radiation to screen through X-ray. So similar kind of radiation we are using in a CT. So we have using radiation exposure level of X-ray to generate image quality of CT, where this AI is helping us to do that. This is one of the case study where the physician was developing AI. This is the image of the breast of the woman. She has undergone screening in 2011, 12, and 13 with help of biopsy, it has been identified that she has a cancer. But when we run the same image through the AI, they have identified that there was a lesion which has not been addressed in 2011. If they would have addressed it in 2011 itself, she did not undergo such kind of pain. See, when anyone get disease, it's not about financial burden, it's mental burden also. Not just the individual undergoes that kind of trauma. All the caregiver around him or her, they have to undergo very traumatic situation to deal with that. So what we are trying to say is that AI is helping me identify the disease at early stage where it can be treated with a minimal invasion. So if you look at this image, what we eat, it reflects on our heart. So one has to be very careful. Even your organization, I know that you are organizing many sessions for that. So keep focus on that, what they have to eat, and they have to eat healthy. So till today we have screened more than 50,000 people and age group 40 to 50. ratio, if you look at the men and women, is approximately 60 to 40. Very few women come forward for a screening because she thinks that men of the house is more important. That's a problem, and when many times in organization we say that we give the HR offer the services to women, but she sends her husband. Many times we refuse, no, she has to come because the organization has given you this detail. So we have a great finding, around 21% of our population, those who have screened with us, has a heart problem. Of course, in a man it is more, and a female they have less. However, identification is alarming because 21% is not less. Another big notorious thing is visceral fat. Generally, visceral fat, we go in a mall, we pay 5 rupees, 10 rupees, we stand on the machines and they say that you have a visceral fat. But we are the first company in India that we started using CT scan to identify the visceral fat. Unfortunately, 70% of our population have this problem. They have excessive visceral fat. Almost 30% are beyond limit. They have to go and do something immediately, otherwise it is very, very challenging. Again, when you look for the bone, because nowadays we are not getting enough exposure to sunlight, we are not physically moving all around. So we have seen that bone is becoming weak day by day. And especially in this category, women are more impacted. So 18% of populations have a problem with their bone, and almost 3 to 3.5% of we have find that they have osteoporosis, which need to be addressed immediately. Last but not least, as per the WHO record, 10% of world population is going to get breast cancer. We have similar kind of situation here also in India. Out of the total audience whom we have screened, 10% where we have lesions or some kind of cyst in organ where this. I am showing this for because these things are very high when we look at overall data of us. We have made and I have shared this data based on the screening of the 50,000 people whom we have screened. So right now we are only in 4 cities. We have started in 21 during the COVID time. We thought we have got stuck, but anyway, it's today we are doing great. And internationally also we have 2 centers in Mongolia and Vietnam, apart from the Japan where we belong. And these are our few early believers who believes in us. I invite you all to be part of the good health. Reach us, we have all the options which we can talk to the corporate. Currently we are engaged with 140 corporates, we can talk to many more. So we do not have options, we are very soon expanding across the country. So please, you all are invited to experience us. Come, you all are welcome. Thank you.
Thank you so much, Mr. Abhay.